Madam Secretary, are you concerned that proposals to expand government-run health care could run counter to the President's principle that if you like your current health care, you can keep it?
Representative, I think it's always a concern, and again, it may have more to do with the overall plan design than the philosophical principles moving forward. I can assure you that those two principles, Americans keeping their health coverage if it is satisfactory and serves them and their family well, and having a choice within an insurance exchange for a public plan option, are not mutually exclusive. It isn't either or.
How do they compete? How does a private plan compete with a government plan which can be subsidized, which perhaps could start off innocently but be changed at any time to where a private plan could not compete? How could they ever coexist?
Well, I think, Congressman, the examples of that, again, are in place across the country. 30 of the states have state employee health plans where there is a public option for state employees side by side with a variety of private options, created largely to give those state employees in a state like mine in Kansas a choice, because much of our state only had one private provider, and we felt giving employees a choice for themselves and their families, a competitive choice, was important. A number of states have constructed their CHIP programs, the health insurance plans for children, in exactly the same way, where there is a side-by-side option of a private provider and a public provider. What I can assure you is that it can be done as a level playing field. It's about the rules that are established in the beginning, and that the President and I are committed to working with members on this committee and members in Congress to make sure that the playing field is level. And as I said, the private insurers currently have, in fact, I would say, a tilted playing field in way too many areas where cherry picking on the market is a strategy to make a profit, so that the ability to underwrite individuals' medical conditions to either make insurance unaffordable or unavailable is a current private market strategy. I think that measure doesn't work well in a health insurance exchange any more than a measure which would give government huge advantages and huge subsidies doesn't work well. So I think if the rules are the same, so individuals who have lower income, who are not insured, have a subsidy benefit as they come into the health exchange and can choose between a public and private plan option with the same kind of rules, I think it can work as a very important competitive situation where it will help drive, where people will be competing, public and private will be competing not on underlying price or on unfair government subsidies, but really on practice and protocol, on lowering overhead costs, on lowering administrative costs, and driving benefits to their incoming enrollees.